Public health facilities are not only a major source of critical healthcare interventions, but they also consume a significant amount of healthcare resources. According to the World Bank, public hospitals in low and middle income countries consume approximately 30 to 50% of healthcare budgets. One of the most crucial predictors of public health facility success is the healthcare purchasing arrangements, and specifically the mechanisms utilized to finance their operations. The Strategic Purchasing for Primary Healthcare SP4PHC project was initiated to improve how governments purchase primary healthcare services with a focus on family planning and maternal, newborn and child health. The project was supported by the Bill and Melinda Gates Foundation and implemented by ThinkWell and partners in 5 countries: Burkina Faso, Indonesia, Uganda, the Philippines and Kenya. According to the Global Health Expenditure Database, Kenya's health expenditure per capita in 2018 was $88.4. The primary healthcare expenditure per capita was $64.1, which was 72.5% of the total health expenditure. The SP4PHC project collaborated with key stakeholders to strengthen health purchasing policies and practices at the national and county levels that can improve delivery of family planning and maternal, newborn and child health services. These stakeholders included the Ministry of Health, county governments' departments of health, National Hospital Insurance Fund and Kemri Wellcome Trust.
The health financing landscape in Kenya is characterized by a series of healthcare financing reforms. The most recent of these is the introduction of the free maternity service in Kenya and the removal of user fees at level 2 and 3 facilities. And this happened in 2013. In 2018, we saw the launch of the pilot for the Universal Healthcare Program, dubbed Afya Care, in 4 counties. And earlier this year in 2022, we saw the scale-up of the Afya Care program to all counties. In Kenya, we have various purchasers. We have the Ministry of Health, the National Health Insurance Fund, and counties. Purchasing is strategic if decisions about the allocation of funds is based on information about provider behavior and population health needs in order to maximize health system goals.
Kenya has been on a journey on UHC, and we know that health financing is very critical on that journey, very critical towards UHC. Therefore, looking at the overall financing landscape and defining where we want to go has been one of the critical areas. Over the years, we've had the increasing of government financing to health, and the current estimates are showing that at least out of the total health budget expenditure, government puts in 47%. The out-of-pocket that we want to reduce, this is what comes from the individual Kenyans, is about 26%. But good progress, because in 2013, this was around 34-32%. Right now, we have dropped to around 26%. And as we implement UHC, we want to move to maybe around 10%. And then the private sector investment is about 6.7%, while the donors' contribution to the total health expenditure is 19%. Looking at the allocations at the county level, at least on average, counties are allocating at least 30% of their budget, total county health budgets to health, although there are a few counties that are below the 30%, but the progress has been good. You know, the general increase in budgetary allocation to the health sector. However, we still do have a few areas of bottlenecks. For example, when we look at the insurance coverage, it's still quite low at around 19%, with private sector insurance taking around 2%. And as we move to UHC, this is one of the areas that the government wants to address.
We as a country are aiming to achieve universal health coverage. And universal health coverage is a scenario where, the whole of population has access to good quality healthcare services whenever they need them, and they are financially protected from not incurring any financial hardships as a result of accessing care. So there are three key components, and quality of care is one of those three, is one of the tenets of universal health coverage. As the country tries to strive to achieve universal health coverage, then we need to consider about, what is the quality of care that we are providing within our facilities. And that's why ThinkWell came up with this project to try and see, yes, in as much as we are aiming to make sure everyone accesses services, how do we even first of all define quality in Kenya? And then how can we measure it, or what are the systems that exist to measure quality of care in Kenya? And then how can we leverage on a component of health financing, which we are calling purchasing, to make sure that we deliver on better quality care.
Counties have a lot of data in terms of health service delivery, and so we are looking at how we could utilize the data available and the tools that are available. The Kenya Quality Model of Health will be looking at how we can utilize this to then link that to strategic purchasing, and this could be in, at NHIF level, to see how we reimburse for services that are offered at the facility level. And also, in a broad lens, see if this kind of linkage between quality and strategic purchasing leads to improved outcomes. As a result of the Linda Mama reimbursements, do we have improved maternal health care? So these are some of the parameters that we're looking to answer in our quality capstone.
Before devolution, we had gotten to a point where health facilities would collect and retain the revenues that they generated, and they did not need to submit these funds to the district treasuries, because before devolution we had districts. Now after devolution, all the county governments insisted that they needed to apply Section 109 of PFM Act that says that all revenues should be submitted to the County Revenue Fund. So what ThinkWell has been doing over the years is to help counties appreciate that you could retain these resources at the health facilities as you still ensure that accountability structures are maintained to ensure that Treasury is still able to have a clear understanding of the volume and the volume and the trends within the collections of these funds at the health facilities.
The SP4PHC project focused on 3 counties, namely Isiolo, Kilifi, and Makueni.
We came and carried out a landscaping study that mapped out the entire architecture for youth financing to understand how revenues flow, how planning and budgeting processes take place in the county. And we were able to form the first basis for our technical assistance based on evidence.
At the core of providing health services or universal health care, you have to have a robust financial plan. Without that, then you will not really provide a sustainable healthcare services provision system. Our work with ThinkWell, we were helped to look at this issue of health financing so that we are realistic in terms of mobilizing funds for that, because of course funds are limited.
One of the key things that we've been able to do with the Makueni County, and of very much importance, is to rethink how counties send money to facilities. The county is now using resort-based financing mechanisms to finance healthcare to increase certain tracked indicators for performance.
We have also had a very good working relationship with ThinkWell. They help us to map out what is our target for revenue in terms of both Linda Mama, NHIF, and even our own money, which we collect from the services that people come when they visit hospitals, which they pay. We have been able to move from about 90 million, and now in a financial year we are collecting up to 130 million. Mothers who come to deliver in our primary healthcare facilities, that is dispensaries and health centers, previously that money would go unclaimed. But now, with the collaboration with ThinkWell, we are able to assist facilities, do capacity building, provide printers, provide internet, so that their online claiming from NHIF is really increased.
Another important work that we've been able to pursue with the county is supporting the county to develop regulations for the facility improvement funding, which allows or gives a guideline or a mechanism for how monies raised within facilities can be used to improve quality of services.
In Makueni County in the year 2017, through the County Assembly then, passed Makueni Health Services Act. That law has really assisted this county, has increased efficiency. Hospitals have autonomy, they have their own accountants, they have their own procurement units, so that turnaround time for the things that they need, drugs, non-farms, and so on, is very high. They don't have to rely 100% on central procurement from the department. ThinkWell has really worked with us. We have worked with them very closely to formulate regulations that support that act. And we are at a very advanced stage of having the same regulations passed by the County Assembly of Makueni.
Located in the arid and semi-arid parts of northern Kenya, Isiolo County happened to be one of the 4 counties in which the government of Kenya launched the Afya Care Universal Health Coverage Pilot Program in 2018. The Isiolo County Department of Health and ThinkWell undertook a rapid review of the pilot program and the healthcare financing landscape of the county.
When we started our work in Isiolo, we identified Linda Mama as one area that has been hugely underutilized, and a lot of money has been left on the table. We immediately embarked in collaboration with NHIF local branch and the leadership in the sector to see how we are going to claim and benefit from the funds that is domiciled with NHIF.
ThinkWell became that necessary link between the NHIF office and the health department. That link was actually missing because those meetings were hardly there. Through those meetings, we've been able to do something.
Today, as we speak, the county is generating over 11 million that has been dispersed to various facilities throughout the county, and we are expecting that this is going to gain traction, because many facilities have received, they never imagined they are going to receive.
We are now claiming 100% at the county referral hospitals, but that does not mean that we are receiving 100% yet. For these facilities to have accounts that can run, we needed to pass a legislation that will authorize the CEC of Finance to give the authority to the facilities to open accounts. These accounts, the same FIF accounts that Linda Mama will fall under.
The Facility Improvement Fund in Isiolo fairly stopped because Isiolo is one of the pilot UHC counties. So with the introduction of the UHC as a Big 4 agenda, number 4, the services were made all free. Because that is a pilot project and it is stopped after 1 year, then what will happen after the project stops? So therefore, we met and started introducing an idea of the previous user fee, but in form of Facility Improvement Fund. How shall we be able to fund our services so that we'll keep the quality of healthcare delivery to the standard that is required?
We worked with the county and eventually achieved that. The bill has been passed, and we say that is the crown jewel of our achievement in the county, because for a foreseeable future, this bill is going to enable them to have that autonomy that they've been seeking.
Kilifi County is one of the low-resource counties and as such faces a challenge of access to maternal and newborn child health. ThinkWell collaborated with Kemri Wellcome Trust and the county government of Kilifi to also improve purchasing arrangements for primary healthcare services, especially family planning, maternal, newborn and child health services.
By our partnership, the facilities from the department are able now to claim funds from NHIF, and there are regular meetings between NHIF and the Department of Health where they discuss on the challenges that they are facing in implementing the Linda Mama program. So far, over 140 facilities within the within Kilifi County are offering Linda Mama services.
Linda Mama has been a game changer in our community from a different spectrum. We have seen the numbers of skilled deliveries improve from below 50% just about 2 years ago, and now we are at 83%. Also, we are improving on the other indices like the maternal mortalities, the neonatal mortalities. We've seen those also reduced, which again, within the framework of Linda Mama, we can directly attribute that to the program.
Linda Mama imesaidia sana, inawezesha kina mama wasikose huduma, hasa kama za ujauzito, kwa kliniki ya ujauzito, kujifungua. Anapokuja hapa, bora amepata ile namba ya Linda Mama, anajua ya kwamba hakuna pesa zozote zile ambazo ataweza kutozwa. Ile pesa tunapoipata, kuna mambo mengi ambayo tunafanyia hapa. Sasa nyingine hata kuna dawa kidogo kidogo zile ambazo tunakosa, tunatumia ile pesa. Pesa ile pia inatusaidia kuweza kufikia wale wateja wetu kule kwa community, kuweza kuwafikia na ujumbe wa afya.
Linda Mama imenisaidia kuanzia ujauzito wangu mpaka sasa nimejifungua. Imenisaidia, sijaweza kulipia chochote, na pia imenisaidia kutunza ujauzito wangu bila gharama zozote, na pia imeniwezesha kuwa na access kwa kila hospitali yoyote ya kiserikali.
Generally, we have systems that can be leveraged to link purchasing to quality, but we need to operationalize them. We need to move from, wanting to do new things to using what we already have to improve the quality of care within the country.
The county government must now move from sitting down for meetings and doing the real thing. So what is remaining is for them to be given this now as a target. They should include NHIF and the Linda Mama services that have been offered there. How much has been claimed, maybe for deliveries, for antenatal, for postnatal. If they include that as a target, as a deliverable, when they're having their meetings, then we will be able to move forward.
We need to ensure that the application of PFM rules and regulations do not obstruct the shared vision of the country in making sure that all people can access quality health services without having to suffer financial hardship. And that's what this program is raising a voice on, both for national government and county governments in the country.